Welcome to the online portion of CPR-AED training for coaches and sponsors at the Wichita Public Schools. This program is part 1 and will not complete your training. A hands-on skill assessment will be set up at a later date. You will need to do the hands-on portion to complete your training for CASHA. Thank you for joining us in this training. It is important because when it comes to an emergency, you can make a difference.
Can you believe that catch in the game last night?
It was amazing. You know, I thought it was over. I was ready to turn the TV off and go to bed.
Yeah, but they got lucky. They had no business winning that game.
Look, a win is a win.
Yeah, right. Oh, check him out. That guy looks like he was out on the field.
Seriously, though, you think he's okay?
I would assume so since he's out and about, but how can you tell? Hello? I gotta get to the office.
Yeah, me too.
Yeah. Okay. I'll get those documents over to your office later today, then we can discuss where to go from there. Sound good?
Help! Help! Please. Dad, are you okay? Help! Dad, someone help my dad, please.
Sir, are you okay? Sir, are you okay? Call 911. Get an AED and first aid kit right away.
Yeah, we have this at the store.
Okay.
Dad!
It's okay. He's calling 911. Did your father complain about anything before he collapsed, or?
He was complaining about not feeling well, but he always complains, and then he just collapsed out of nowhere.
Do you know if he's allergic to anything?
Allergies... Aspirin. He's allergic to aspirin.
Does he take any medication, or?
I don't think so.
By you completing this training, you help make a difference. It takes multiple people to truly put an emergency action plan into place. This training will help you, help me, and each other accomplish that, or prepare you for situations where your athletic trainer may be at another location. So, when it comes to an emergency situation, where do we start?
Now that you have recognized an emergency and decided to take action, follow the emergency action steps. Check, call, care. Before rushing to help an injured or ill person, you need to check the scene, so stop and look around. By answering the following questions, you will gain the information you need to proceed. Is the scene safe to enter? Hazards such as fire, spilled chemicals, and traffic, to name a few, could endanger you or any bystanders. If the scene looks unsafe, stay clear and call 911 or the designated emergency number. What happened? Check for clues that might tell you the cause of the emergency. How many people are involved? In an emergency with more than one injured or ill person, you may need to prioritize care. What is going on with the person? Form an initial impression about the nature of the person's illness or injury. If you see severe, life-threatening bleeding, take action to control the bleeding using any available resources. Is anyone else available to help? Bystanders may be able to provide valuable information about the situation or the person, along with getting needed items, controlling crowds, and reassuring the injured or ill person. Once you've checked the scene, you need to check the person. If you are not sure whether a person is unresponsive, shout, using the person's name if you know it. If there is no response, tap the person's shoulder and shout again while checking for normal breathing. Check for responsiveness and breathing for no more than 5 to 10 seconds. If there is no response and the person is not breathing or is only gasping, the person needs help right away. This brings us to the second emergency action step. Call. Unresponsiveness, trouble breathing, and severe bleeding are all signs of a life-threatening emergency. If your initial check reveals these or any other life-threatening conditions, make sure that someone calls 911 or the designated emergency number right away. The final emergency action step is to give care according to the conditions that you find and your level of knowledge and training. Always remember, check, call, care, and you'll be ready to respond to any emergency.
So the first step is to check. Check, is the scene safe? Is it safe enough for you to go out and get involved? How many people are involved? Is there one person who is injured or are there multiple? Your initial impression, what happened? Like in that first video that we saw, the guys noticed that there was someone that was just didn't look right. And then when he collapsed and she hollered, they went to go and help. Is there any severe life-threatening bleeding? If there is, that you want to treat immediately. Is there someone else available to help? This is a great place where your assistant coaches come into play and why it is important for all of us to have this training. And then you want to check for responsiveness and breathing for no more than 5 to 10 seconds. Call 911, and then care. Provide care according to the conditions you find. So when we go through this, we want to think about the different types of victims that we might encounter. The first scenario we will go through is checking a responsive person. This is someone who can talk to you and tell you more about what is going on.
If your initial check of a person reveals that she is responsive and awake, get consent to provide care. If she does not have any life-threatening conditions, gather additional information by asking questions and performing a head-to-toe check. Begin by interviewing the person, or if necessary, any bystanders. Use the mnemonic SAMPLE as a tool to remember the interview questions.
So what's going on? Are you in pain?
My arm really hurts. I tripped and fell.
Okay. How are you feeling otherwise? Do you have pain anywhere else? Any shortness of breath, chest pain, or dizziness?
No.
Okay. Let me ask you a few more questions,
Okay.
and then we'll take a look at that arm. Is that okay?
Mm-hmm.
Are you allergic to anything?
Penicillin?
Okay. And what happens when you take penicillin? Have you ever had a severe reaction to it?
No, just a mild rash.
Okay. Are you taking any medications currently?
I'm on blood pressure medication.
And when did you take it last?
This morning.
So do you have any other medical conditions?
No.
When was the last time you had anything to eat or drink?
This morning, a bowl of cereal for breakfast. It's a couple hours ago.
So tell me what happened right before you hurt your arm.
I was going to lunch, and I tripped over a crack in the sidewalk. I'm just so clumsy.
I've done the same myself. Don't worry about it. And did you hit your head when you fell?
No.
Okay, that's good.
Once you've asked the person these questions, look at and gently feel each part of the body from head to toe, checking for signs of injury or illness.
Okay, I'm going to check you now for any other injuries. Do you mind if I touch you?
I don't mind.
Okay, I'm going to start with your head first. I'm going to take a look first. Okay. Does this hurt?
No.
And this? Mm-mm. Okay. Now take a deep breath for me. And breathe out. Does it hurt to take a breath?
No, it doesn't.
Okay. And are you having any stomach pain?
No.
And are you having any hip pain at all?
None.
Okay, that's good. I'm going to take a look at your leg now, okay?
Okay.
Does this hurt?
No.
And this? Ooh, it looks like you have a bruise there. We'll take care of that too, okay?
Okay.
And can you wiggle your toes for me? Are you in pain?
No.
Okay, good. Does that hurt?
No.
How about this?
Doesn't hurt.
And can you wiggle your toes for me over here? Any pain?
No pain.
Good. I'm gonna feel your arm now, okay?
Okay.
Does this hurt?
No.
And this?
No.
Can you wiggle your fingers for me? Good. Okay, I'm gonna feel your injured arm now, but I won't touch the bruised area, okay?
Okay.
Does this hurt?
No, it doesn't.
And this?
Nope.
And can you wiggle your fingers for me? Good. Are you having any back pain?
None.
Good. Let's take care of those bruises now, okay?
Okay.
Once you've completed a physical check of the body, provide care for any conditions you find. If necessary, send someone to call 911.
Okay, so when we check that responsive person, the first thing that's important is that we need to get consent. If you do not get consent, you do not try to treat them, but you can still call 911 even if they won't let you help them. And then once EMS gets there, then they can take over and take over that responsibility. Now, if you have a minor that is injured that does not have a parent present, consent is implied. If their parent is present, you need to get consent from the parent. Or if the person is unable to give consent, it is implied that they would give consent if able. So in those situations, the consent is implied so you can help treat them. Make sure you gather the important information for further medical care, such as some of those questions that were shown in the video, because that's information that you can pass along to EMS when they arrive. And remember, just because they complain of pain or injury in one location doesn't mean that there is an injury elsewhere too. So it's important to do that full look, head-to-toe check. As you saw in the video, she only thought her arm was injured, but then had that big bruise on her ankle as well. So don't forget to go through all of those steps. Now, to focus on what we really came to talk about, it is important to be able to recognize someone who may be having a heart attack or in cardiac arrest.
Being able to recognize when a person is having a heart attack can be a life-saving skill. Signs and symptoms of a heart attack vary from person to person and can be different in women than they are in men. Even people who have had a heart attack before may not have the same signs and symptoms with a second heart attack. Chest pain, pressure, and discomfort are the classic signs of a heart attack. The pain can range from mild to unbearable. The person might describe the pain as tightening, squeezing, or severe pressure. The pain may last longer than 3 to 5 minutes or go away and then come back. Although the pain may feel similar to that of a muscle spasm or indigestion, resting or taking medication does not relieve the pain. The pain may spread to one or both arms, the back, the upper part of the stomach, or the neck and jaw. The person's appearance and behavior may also offer clues. The person's skin may look pale or slightly grayish or bluish, and the person may be sweating heavily. The person may be having trouble breathing and feel short of breath. Some people become dizzy or lightheaded, or feel nauseous or vomit. Others may become unresponsive. Many people who have had a heart attack say that they felt anxious, like something really bad was happening. Others describe feeling unusually tired for a period of time leading up to the heart attack. Trust your instincts and seek advanced medical care immediately when you recognize the signs and symptoms of a heart attack.
So let's go over some of the signs and symptoms of a heart attack again. Most importantly, they may be different between men and women, or even if they've had a heart attack before, this may be different this time. Some of our classic signs are chest pain, pressure, and discomfort ranging from mild to severe. They may last longer than 3 to 5 minutes or go away and come back. Resting does not relieve the symptoms. They may spread to one or more arms, the back, upper stomach, neck, and jaw. Their skin may be pale, gray, or bluish. They may have profuse sweating. or trouble breathing or shortness of breath. They may be dizzy or lightheaded. They may be nauseous or vomit. And there may be some feeling anxious, tired, or feelings of impending doom. If you have any doubt or concerns to the severity of the situation, call 911 and seek help immediately. Now that we have gone over what a heart attack may look like, what is the difference between a heart attack and cardiac arrest? With a heart attack, you still have signs of life. They are still talking to you, but they may progress to cardiac arrest. So with someone having a heart attack, you need to be prepared to start 911 or to start CPR and call 911. Cardiac arrest, however, they no longer have any of those signs of life. It may have started as a heart attack and progressed, or may suddenly appear as cardiac arrest. In this situation, you need to make sure and call 911 and begin CPR immediately. Either way, it is crucial to activate EMS and get help immediately. Your action and recognition of the situation is vital, and you are an important part of the cardiac chain of survival.
When a person is in cardiac arrest, quick action is crucial. The cardiac chain of survival describes 5 actions that, when taken, increase a person's likelihood of surviving cardiac arrest. You have a major role in completing the first 3 actions. The first link in the cardiac chain of survival for adults is recognition of cardiac arrest and activation of the Emergency Medical Services (EMS) system. The sooner you recognize that a person is in cardiac arrest and call 911 or the designated emergency number, the sooner advanced medical personnel will arrive. Early CPR is the second link. CPR helps to circulate oxygen-containing blood to the brain and other vital organs, helping to prevent brain damage and death. The third link is early defibrillation. The electrical shock delivered by an AED may restore an effective heart rhythm, significantly increasing the person's chances for survival. The fourth link is early advanced life support, which is provided by EMS personnel at the scene and on the way to the hospital. Integrated post-cardiac arrest care is the final link. After the person is resuscitated, an interdisciplinary team of medical professionals works to stabilize the person's medical condition, minimize complications, and diagnose and treat the underlying cause of the cardiac arrest. 4 out of every 5 cardiac arrests in the United States occur outside of the hospital. When you complete the first 3 links in the cardiac chain of survival, recognizing cardiac arrest and activating the EMS system, immediately beginning CPR, and using an AED as soon as possible, you can make the difference between life and death for a person in cardiac arrest.
So let's go over this again. The first chain is recognizing an emergency and calling 911. You knowing that something is going on and calling 911 and getting EMS activated is the very first step. Then we have early CPR. The sooner you can start CPR, the better. Also with that, early defibrillation. And then advanced life support, getting EMS there to take over and take on that person to take them to the hospital. And then finally, that integrated post-cardiac arrest care, which is with their physician, and any follow-up that happens after the fact. Most importantly, though, you can make a difference between a person's chance for life or death. So, how do we go about giving CPR? This video goes through the process of hands-only CPR. This will be important when you have your in-person skills assessment, as this is what you must be prepared to do.
Cardiac emergencies can happen when you least expect them. If you are unsure of what to do, You can make a difference by using a simple technique known as continuous chest compression or hands-only CPR. It's easy to learn and can help save a life. If you see a person suddenly collapse, check the scene for safety and see if the person responds by tapping him on his shoulder and shouting, "Are you okay?" If he doesn't respond, call or tell someone to call 911 or the local emergency number right away. Kneel beside the person and put the heel of one hand on the center of his chest. Next, place your other hand over that hand, lacing your fingers together. Position your shoulders directly over your hands, keeping your arms as straight as possible and your fingers off the chest. Push hard and fast in the middle of the chest, at least 2 inches, then let the chest rise completely before pressing down again. Don't take your hands off the chest, just your weight. Chest compressions also need to be given fast, at least 100 compressions per minute. The down and up motion of each compression should be smooth and regular. Do not stop compressions except in one of these situations. You notice an obvious sign of life, an automated external defibrillator or AED is ready to use, another trained responder or EMS personnel take over, you are too exhausted to continue, or the scene becomes unsafe.
Okay, let's go over this process again. First thing, you want to check for signs of life for no more than 5 to 10 seconds. When you're giving compressions, you want to push down at least 2 inches. You want to push hard and fast. The compressions should be given at a rate of 100 to 120 beats per minute. This is most effective if you start counting out loud, but there are a lot of songs and playlists out there that are also at that appropriate rhythm. Most common one that we hear about is Staying Alive. But the important thing is you need to go at that 100 to 120 beats per minute. Slower isn't going to be effective, and faster is also not going to be as effective as that rhythm specifically. When you are giving CPR, remember that hard 2 inches that you need to be going at least 2 inches. You will break ribs, but that's an okay thing because that means you're going deep enough. And so keep going. Don't let that surprise you or stop you. Don't stop unless there are obvious signs of life, an AED becomes available and is ready to use, another responder can take over, which is another reason why having you all take this training becomes important, because then there's more than one person to help administer CPR. EMS arrives and takes over. You are too exhausted and unable to continue, and the scene becomes unsafe. Another important component is the use of an AED.
For someone in cardiac arrest, calling 911 or the designated emergency number, starting CPR immediately, and using an AED as soon as possible gives the person the best chance for survival. Cardiac arrest can occur when the electrical impulses that cause the heart to contract rhythmically become abnormal, disorganized, and chaotic. The heart will stop beating or beat too ineffectively to circulate blood to the brain and other vital organs. 2 abnormal heart rhythms in particular, ventricular fibrillation and ventricular tachycardia, can often be corrected by defibrillation, the electrical shock delivered by an AED. When effective, the shock disrupts the abnormal electrical activity long enough to allow the heart to spontaneously develop an effective rhythm on its own. An AED is simple to use. The device will guide you every step of the way. AEDs can be used on people of all ages and can also be used on pregnant women. All you need to do is turn the device on and follow the voice and visual prompts. Remember, start CPR immediately and use an AED as soon as possible. For each minute that CPR and AED use are delayed, the person's chance of survival is reduced by about 10%.
Let's review this information again. Defibrillation may correct the heart's irregular rhythm by disrupting an erratic rhythm and allowing the heart to return to a normal rhythm. They are very, very user-friendly, easy to use. They tell you exactly what to do, and can be used by anyone and on anyone. And most importantly, I want you to realize and take this in. For every minute that CPR and AED use is delayed, the person's chance of survival is decreased by 10%. That's a huge number, and that shows you exactly why this is so important. Using an AED is simple. It will tell you what to do and can be used on anyone, by anyone.
When a person is in cardiac arrest, use of an AED can help restore a normal heartbeat. If you are the only trained responder on the scene, turn on the AED as soon as it is available and follow the voice prompts. Once the AED is turned on, remove all clothing covering the chest and wipe the chest dry if necessary.
Attach pads firmly to person's chest as shown.
Using the appropriate sized pads, place one pad on the upper right side of the chest and the other on the lower left side of the chest below the armpit. Remember, you should not use the pediatric AED pads or key on anyone older than 8 years or weighing more than 55 pounds. Plug the pad connector cable into the AED if necessary and prepare to let the AED analyze the heart's rhythm. Make sure no one, including you, is touching the person. Say, "Clear."
Clear.
In a loud, commanding voice. Be ready to deliver a shock if the AED determines one is needed. To do this, make sure no one, including you, is touching the person. Again, say, "Clear," in a loud, commanding voice. Push the shock button to deliver the shock.
Shock delivered.
After the AED delivers the shock, or if no shock is advised, immediately begin CPR starting with compressions. Continue giving CPR and following the AED's prompts until you see an obvious sign of life or EMS personnel arrive. If there are 2 or more responders, the steps will be slightly different. Responder 1 will continue CPR, while Responder 2 sets up the AED. When the AED prompts, analyzing heart rhythm, Responder 2 says, "Clear."
Clear?
Then the responders switch roles. Responder 1 will now operate the AED, and Responder 2 will now provide CPR. The responder should switch roles in this manner each time the AED analyzes the heart rhythm.
Shock delivered. Begin 5 cycles of
Notice how CPR and AED use are working together as parts of the cardiac chain of survival. When CPR is not interrupted to prepare the AED, chances of survival are increased.
25, 26, 27, 28, 29, 30.
As you can see, using an AED and CPR go hand in hand. They go together. So be sure to review the locations in your building of your AEDs. Let's go over that information again. Remove all clothing and wipe the chest dry as needed. If you have help, you may want to designate one person for crowd control for patient privacy. That chest needs to be dry though so that the pads will stick. The pad placement is upper right and lower left. However, if you can't remember that, a lot of times there are pictures on the pads, and the way that the district's AEDs pads is it's already built in to do all of that, and has a bar to go over the chest for you to continue to do chest compressions. PEDS pads are for children 55 pounds or less, so they are, and all of our AEDs do have pediatric pads, but just make sure that you use them only for young children, and make sure that no matter what, none of your pads are touching each other, because otherwise that completes the circuit and the defibrillation won't actually happen. Adult pads may be used on anyone, whether they're a child or an adult. Just ensure that the pads are not touching each other. So for a child, you may need to put one pad on their chest and one on their back in order to accomplish that. You want to make sure that no one is touching the patient while analyzing. You want to say clear and make sure that no one is touching so that the machine doesn't accidentally pick up on your own heart rhythm and not truly analyze that of the patient's. And then if the shock is advised, ensure no one is touching the patient. Say clear and give a shock, then resume CPR. You want to ensure that no one else is touching the patient when you deliver the shock, because they may also receive that if they are touching the patient. Okay, there you go. So now you should be ready to report to an appropriate checkoff portion at a scheduled school location. You will be expected to perform hands-only CPR on a mannequin. Don't forget the whole process though. Check the scene, check the patient, call for help, begin hands-only CPR. You can make a difference by choosing to act. Don't forget to complete the in-person checkoff, because that will complete your CASHA training. Thank you.